So I'm Judith Raposo, and I am a staff physical therapist at Community Regional Medical Center, primarily working in the burn unit, and I work in both the inpatient setting and also in the outpatient burn clinic. Before we had Child Life specialist here as part of the burn team, we had to kind of sometimes wing it a little bit. So I use a lot of toys and things when I'm doing therapy with kids. So I would end up having to try to do distraction and play at the same time I was trying to do some other type of therapeutic procedure. So it really made treatment a bit more cumbersome. It's a lot smoother running when the kids have someone else there to be their advocate and work with them. And from a child life specialist standpoint, while I'm doing a procedure, it allows me to really focus on the impairments and things that I need to address and not have to be doing everything all at the same time.
My name is Shana Henry, and I'm a registered nurse here in the burn unit that works in the outpatient services as well as inpatient services. And I also provide outreach to children and do burn injury prevention education to the community. Probably a couple years ago, we had a 4-year-old child that was completely in shock. The hospital stay really affected him, and he became nonverbal. And he would not talk nor make eye contact with any of the staff. And with the help of Child Life, we were able to put together a game. And it was as simple as a Tupperware container with a monkey face with the mouth cut out. And that child, every time they would make eye contact or answer a question with a nurse or a doctor, anyone from the interdisciplinary team, we gave him fake apples and oranges to feed the monkey. And what we didn't realize at the time is that Child Life was able to build a relationship with this child and realized that he loved Curious George. And so that was really the pivotal turning point in which I feel that a lot of our staff were able to open their minds to Child Life and realize what a beneficial part it is to nursing care and just their overall care.
Hi, my name is Sean. My son actually was recently admitted to the hospital for an illness and has an extended stay at the facility. And at the time, he was really fearful about what might be occurring, as well as his father being very fearful about what was occurring. And I had the opportunity to actually experience care provided by a professional group that I wasn't familiar with before called Child Life Specialists. And if you could imagine from a child's perspective, you're here in a strange environment, probed and prodded, lots of interventions going on, lots of strangers coming in and out, and you're not really understanding everything that's going on. And you have this person that comes in and offers entertainment, the ability to go ahead and watch what he or she wants to watch on television or watch a movie. For instance, my son, they even brought in a Wii machine and video games, a tablet, posters, stickers that could be put on the wall to give him his room a personal feel, personal touch, so he feels that he's at home. So with Child Life Specialists, I really got to see how important that role is in the care of children.
I'm Bill Dominic. I'm the Burn Center Director here at Community Regional Medical Center. We've had a Child Life work here involved in the Burn Center now for several years, and it very quickly has become apparent that it's been a really important addition to what we can provide for our patients. In the best of circumstances, this is an extremely scary environment for both adults and children. And children, of course, don't have the experience or the coping skills often to process what's going on when they're injured. I think all of us, the nurses and the doctors, do our very best to make the children feel welcome and safe, but that can't always be the focus of what we do. To have a person that is focused on helping the child deal with their environment, deal with the potential for pain, the separation from their family, all the things that are involved in their experience of their care, to have someone do that and be able to focus on that is extremely beneficial. Also, as our patients begin to recover, they can actually physically spend time with their family members. out of the unit. And we're lucky enough to have an area in the hospital, in the burn center, where that can take place. And that often falls to the child life worker to make those arrangements and to prepare the sibling of the burned child or the child of the burned adult for what they're going to see when they see their family member maybe for the first time in a long period of time.
So care at Community Regional with the pediatric service line would be tremendously different without Child Life. As a matter of fact, when I started in pediatrics, we didn't have Child Life to help. And, it's the difference between holding down a patient, trying to get an IV, to having a patient sitting there comfortably, no stress. I can put in an IV and the child can still be smiling, like doesn't even notice, because Child Life with their presence at the bedside makes that big of a difference with distraction and pain relief techniques. And also just helping prepare the child for the age-appropriate interventions and letting the child know really in a specialized way for their age group what to anticipate, and as well as the parents. And I think that sometimes knowing what to expect helps them. Sometimes you think it will scare them, but Hannah, especially our child life specialist, she just has a natural way of just putting the kids at ease. And so I really feel like our care here would not be half of what it is without our child life specialists. They are just an absolutely necessary part of our team.